Good afternoon. As I said yesterday, it is important for all Missourians to stay updated on the facts of the COVID-19 crisis. As of 2 p.m. today, there have been 670 positive cases of the COVID-19 in Missouri. Also, as of today, there has been 9 COVID-19 deaths in Missouri. The situation is constantly changing, but we are taking steps each day to adapt and respond. I want Missourians to know we are working around the clock to protect public health and support our citizens in every way possible. Yesterday, President Trump approved our request for a major disaster declaration for the state of Missouri, and we appreciate this quick action and his commitment of federal resources as we continue to fight this battle. To further assist with our COVID-19 response, I have also signed an executive order mobilizing the Missouri National Guard. But I want to be perfectly clear, this is not about putting Missouri under martial law. This is a planning stage operation to provide more assistance to Missourians and increase our capacity to deploy resources quickly. The Guard will play a major role in supporting state and local communities, including the potential support of COVID-19 testing and transporting equipment and supplies, just as we did during the floods last year. The Guard is prepared to answer this call again and step in to help wherever they are needed during this crisis. Today, Adjutant General Compton is here to provide more details from the National Guard. General?
Thank you, Governor. Again, thank you, Governor Parson. As soldiers and airmen and a key component of our nation's armed forces, we remain ready to fight and win our nation's wars when needed. But unlike the other components of the armed services, the National Guard's other mission is to support civil authorities as authorized and directed by the governor of this state. Let me assure the citizens of Missouri that your Missouri National Guard is ready for this mission. Let me also assure you that we are not some outside organization coming in to impose someone else's agenda on you. We are here to help you, not control you. Hell, we are you. We are your sons, your daughters, your brothers, your sisters, your dads, your moms, your neighbors. We are your Missouri National Guard. Our motto is that we train, fight, and win while taking care of each other as one team. You are part of that team that we intend to help, take care of, and I know Missouri citizens will do that for us. The Missouri National Guard is committed to the health and well-being of our citizens, service members, and their families. From the beginning, in the preparation for this mobilization, the Missouri National Guard has been fully integrated in the planning and execution of the COVID response with our state and national leaders. We are working closely with the governor, the Department of Public Safety, the State Emergency Management Agency, the Department of Health and Senior Services, the Missouri Health Net Division, and other agencies supporting and coordinating a coordinated response. Our longstanding state and federal partnerships will help ensure a rapid and unified response, and this mobilization allows us to be even more integrated and bring more resources to bear. In addition to our already ongoing coordination and integration, we have taken an aggressive approach to preventing the spread of the virus amongst our own forces in order to ensure we are capable and ready to respond to the needs of our citizens. We have been following guidance from the Department of Defense, the Centers for Disease Control and Prevention, and screening all service members entering our armories and training sites. In short, because of these measures, we are in a position to be able to respond. We are prepared to support our local and state authorities in any way we can. Based on our past experience, support being provided in other states, and the nature of this pandemic, it is anticipated that there will be a varying array of missions that we might become involved with. Missions might include helping to set up community-based testing sites, as the governor just mentioned, operation of those sites, providing interstate transportation of personnel and equipment for medical or testing support, and logistical support to local and state authorities as needed. In fact, I'm sure there are needs that will come out of this pandemic that we aren't even aware of yet, but rest assured, your Missouri National Guard will do whatever we can to help. Let me end by saying that I'm extremely proud of our citizens, soldiers, and airmen. Your Missouri National Guard stands ready to serve our neighbors, families, and friends in the communities in which we live and work. We will train, fight, and win this war against COVID as a team and come through this stronger together. We are, in fact, one team, united as Missourians and Americans, and we will win together. Thank you.
General, thank you. Needless to say, with the leadership of General Compton and the men and women that serve the Guard here in Missouri, and I will put them up against any unit in the United States, and for them to be on the front lines to help with the COVID-19 situation, we're blessed here in Missouri to have the leadership like General Compton and the men and women that serve the Guard here in Missouri. As a number of the COVID-19 cases increase, we know there have been a lot of questions about support for Missouri's healthcare system, such as hospital bed space, overflow locations, and isolation sites for healthcare workers. One of our primary objectives is to do everything we can to support the healthcare delivery system and ensure hospitals have the equipment they need. We have tasked Missouri Healthcare Net Director Todd Richardson to help coordinate many of these efforts. Todd is here with us today to give an update on where they're at on the assistance they're providing against the fight on COVID-19. Director Richardson.
Governor, thank you, and thanks to the other cabinet directors and state departments that you've tasked to help with this important mission of supporting our healthcare delivery system. As the governor has made clear, one of our central priorities and responsibilities in dealing with this outbreak will be to support Missouri's healthcare delivery system. We have been engaging in regular and systematic communication with our healthcare partners to assess their capacity, their staffing needs, and their need for supplies. We have a great team assembled across state government that includes the Department of Health and Senior Services, Department of Public Safety and SEMA, the Department of Economic Development, Higher Education and Workforce Development, the Office of Administration, the Guard, and many others. We have already taken action to streamline the application and licensure process for Missouri healthcare providers. The Department of Health and Senior Services and Department of Public Safety have been taking delivery and distributing critical personal protective equipment. Director Dixon and his team have worked to identify housing support that can be deployed for affected healthcare workers. And finally, let me say this. Missouri is fortunate to have great healthcare systems, both big and small. And there is significant capacity and will to deal with this outbreak. That capacity is expanding every day. But the backbone of our healthcare system are those dedicated first responders and healthcare workers that are on the front lines every day, providing care for Missourians and keeping us safe. Every day, they give Missouri their very best, and they deserve our very best, and that's what they're going to get.
Todd, thank you very much, and thank you for the job that you're doing. Kelly, let's turn it over for some questions right now, if you got a few questions.
I do. I've accumulated various questions from the reporters that have sent in via email or text, and then I do have a common question from constituent services. So we'll begin with you, Governor Parson. This reporter, Sebastian Martinez Valdivia from KBI in Columbia. Governor, would you consider overruling city or county executive orders that you think are too restrictive?
I would not. I have the confidence in the mayors across the state of Missouri to make those decisions for their local communities. And I think it's important that we support them on those decisions. We have our order in place, they have theirs, and again, I think the most important message out of this is to make sure that people understand how important it is to abide by these orders.
Okay. This question is also for you, Governor Parson, from Jacqueline Driscoll, St. Louis Public Radio. The governor says the vote on the supplemental budget is a priority. Is the governor asking for a vote within a certain time frame?
We are under guidelines for the supplemental budget. I had a meeting with leadership yesterday. We spoke to them. It's crucial we get that supplemental done, and that drop dead date, I would say, would be April the 24th. So we have to get it done for that. My understanding is the legislature is trying to figure out a plan to come in here somewhere around the 1st of April to get that done. But we all understand the importance of getting that supplemental budget down. And for the people who maybe doesn't understand the supplemental budget, what we say, but that is the funding source for the federal money coming in to gives us the authority to accept it and to spend it. And it's much different on the state level as on the federal level, where we can just continue to make, we can't continue to make money like the federal money or like the federal government can. We have to be able to abide by the Constitution and say we spend within the in the format that we have.
Okay. The next question will be for Director Richardson. Director Richardson, this is also a question from Sebastian Martinez Valdivia from KBI in Columbia. She'd like to know if there are emergency facilities set up to provide intensive care units in rural areas.
We're working every day to assess the capacity, not just in our large population centers, but across Missouri. And as we get a more accurate picture of what that capacity is, I believe that Missouri's healthcare system and the systems both big and small are going to have the capacity to handle this with the state's support. And we're going to do everything in our power to support our healthcare delivery system, but also to augment capacity where necessary.
Okay. This one also is for you, Director Richardson. This is from John O'Sullivan from KMOV. There was a study from the University of Washington that was sent out today with various data and numbers. And the ultimate question is, what is the state doing to bridge the gap on needed hospital beds and the ICU beds?
It starts with making sure that we support the expansion of capacity within our existing healthcare systems. And so that means first, our health systems, many will already have seen, have taken action to reduce their inpatient admissions today. They've also taken the steps to reduce elective surgeries to free up capacity that may be necessary to support. They're also making big changes and big structural changes, and I'll call everyone's attention to the work that Steve Edwards and the Cox Healthcare System are doing in Springfield today. In just a few weeks' time, they've managed to add 50 intensive care units at Cox Hospital. That's the kind of thing that's happening across our state right now, and I'm confident that with the state's support, we're going to have the capacity we need to deal with this challenge.
Okay, thank you. All right, this next question is for General Compton. I have a question from Rudy Keller from the Columbia Tribune. He'd like to know, General, will any units or personnel be called to active duty?
Well, hey, as I mentioned in my opening statement, we are working closely with our state and federal partners to provide a coordinated, unified response, and we are ready to mobilize at the needs that the Guard can bring to bear to support the civilians and citizens of our great state. Thank you.
All right, Dr. Williams, I have 2 or 3 questions for you. This one is from Lucas Geisler from ABC 17 News. Missouri and Kansas have each tested roughly the same percentage of the state's population. Missouri has a higher rate of positive cases than Kansas. Do you have any explanation for why Missouri's rates may be higher?
Thank you for the question. We've had about 670 positive. We're doing anywhere from 1,000 to 1,500 tests a day. As we see that positivity rate increasing nationally, we're also seeing that we've been quoting 6 to 8%. It's looking more like 10% now. Half of the cases in Missouri have been in 2 areas, St. Louis City and St. Louis County. So we think that following the trend that you're seeing nationally, you're seeing more cases in urban areas, unlike in northern Italy, where it started out in rural communities and went to cities. What you're seeing around the United States is more urban clusters. And so we think that reflects what we're seeing here in Missouri. And we'll see, again, if we're doing 1,500 tests a day, 1,200 tests a day, we fully expect that we'll see about 120 positive a day, which reinforces the governor's message, is that social distancing is more incredibly important than ever.
All right. This one, Dr. Williams, is also from Jacqueline Driscoll from St. Louis Public Radio. Can we have an update on how many Missourians have been tested, and do we have enough tests for them?
We have tested about 7,000 people. We keep up with it daily, coming in from about 8 to 9 labs. More labs are coming on board. As we work out our strategy, we obviously would like to have more testing. But on the other hand, we think we're getting to a place where we're seeing what we need to know, which is that social distancing is really important. We have enough positives now that we know that there is community transmission, and we know that community transmission can end up in our high-risk groups, like nursing homes. And so we will be doing more testing. We have the equipment and more labs coming on board. But at the end of the day, the tests serve two purposes. One is to isolate those people that won't spread the disease. But it's also very much a message to the community of the importance that the disease is prevalent, especially in those two counties, and people really need to practice social distancing throughout Missouri.
All right, and my final question for you, and then I have one last one for Governor. This one is from Sarah Oakson from DC Report, and she asked, what is the procedure for getting ventilators from our state, or for our state? And how many ventilators are there?
Thank you for the question. Daily, the Missouri Hospital Association provides a list of all the ventilatory capacity in the state, how many are being used, how many ICU beds are being used, how many are available. We have 123 ventilators that the state owns, that we have a process for distributing those regionally as they're needed. That's very well laid out. We work very closely with the Missouri Hospital Association in that. We've ordered 220 more ventilators for the state of Missouri should we need them. So again, our message always is hope for the best, prepare for the worst, and working with Todd and the Missouri Hospital Association and Director Carson and the governor, we feel that we are prepared for just that.
Okay, thank you. All right, Governor Parson, we have one last question for you. This is a common question amongst our constituents of Missouri. Nearly half of the governors in the country have issued a stay-at-home order in their state, yet you still have not. Even though the largest metro areas in the state have and are calling on you to adopt these orders, Governor, are you going to change your position?
Every day I come in here and talk to Missouri people, I tell them to stay at home. Every day. We're following the guidelines of the CDC. All of this changes daily to where we make those decisions, and that decision might change tomorrow. It might change from a week from now. But right now, we're following those guidelines. Every day, we're trying to tell everybody during this 15-day period to stay at home. And we're going to continue to do that because that is the answer to how we slow the COVID-19 down. And again, whoever sets the rules, it's a matter of following the guidelines. And we are doing that now, as we say every day. You need to stay home if you don't need to be out. All right, let's finish up with that. As I've said throughout the COVID-19 response, we will continue to pursue every possible way to protect Missourians and help them recover from this crisis. And we will get through this, and we will be okay. But as I have said, it is going to take all of us working together. Again, the most important step Missourians can take right now is staying at home as much as possible. Every day you need to be thinking about how this affects others, not just yourself. We all need to be thinking about our families, our friends, and our fellow Missourians. The more people reduce their public contact, the sooner COVID-19 will be contained, and the sooner we will overcome this challenge. Thank you very much.